Going to discuss axis, and basically axis is not maths and it's not degrees. It's something that you shouldn't be panicking about. Axis is just one question: which direction is the electricity traveling in the chest? That is it. And imagine the heart firing like electricity, like a shout, right? So if you look at this diagram, yeah, imagine that the heart is here firing electricity, and the ECG leads are just microphones around the body. So let's assume that this is lead 1 microphone, lead 2 microphone, lead 3, this is AVF, this is AVL and AVF, right? So it just tells us what direction is the electricity traveling in the chest, right? So instead of memorizing charts, we're just going to listen to where the shout is going. Now, here's the part nobody tells you. You don't need all the leads. You just need 2 leads. You need your lead 1, right? And you need your AVF. If lead 1 will tell you if it is left versus right, AVF tells you if it is up versus down. That's the entire axis story. So first, look at lead 1, right? In your lead 1, this is our ECG here. In your lead 1, is the QRS mostly up or mostly down? Here the QRS is mostly up. And AVF tells you, and if it is up, it means the electricity is heading left. If it is down, electricity is heading right. So where is this heading here, right? But we need to also look at AVF. In AVF, is the QRS heading up or is it mostly down? Now, if it's up, it's electricity heading down. If it is down, it's electricity heading up. So you now combine the two. If it is up in lead 1 here, right, and up in AVF, that's normal axis. That means the heart is pointing, right? It's pointing, like we said. If it is heading up here, right, that means it is heading left. And if it is heading in AVF, if it is heading up, that means the electricity is heading down. So if it is up in lead 1 and up in AVF, that's normal axis. The heart is pointing where you should expect. And this is what we mean by this circle, because that means the electricity is pointing up in 1 and also up in AVF, right? But now combine the two, right? If it is down in lead 1, so if instead of this upright QRS, you have a more negative QRS, right? And it is down, right? If it is down in lead 1 but up in AVF, that is right axis deviation. So what we mean here is, for instance, if lead 1 is positive and AVF is positive, that's your normal axis. If lead 1 is positive, right, and lead 2 AVF is negative, so what you have here is left axis deviation, right? And sometimes we also look at lead 2. Lead 2 can help us, give us clues as well. So if lead 2 is also negative, you treat your lead 2 like your lead AVF, like your AVF lead, So if lead 1 is positive, AVF is negative, and lead 2 is negative, that's your left axis deviation. In its right axis if lead 1 is negative and AVF is positive. But let me explain that here. So if, for example, your lead 1 is positive, as you can see here, and your AVF is negative, where is that? So lead 1, as we can see, is positive, and AVF, when we say something is negative, that means it is going against the direction it should go, going in the opposite direction. Where does it go? And that is your left axis deviation. It's right axis if lead 1 is negative. Again, I said it's negative, it is pointing in the opposite direction. So instead of pointing towards here, the electricity is going this way, and AVF is positive, right? Then we are talking about a right axis deviation, because now it's in this quadrant here. But in no man's land, that's what we call when lead 1 is negative. So where's lead 1? We know you should point towards here, but lead 1 is going in this way, and AVF is also negative, going in this way, right? So the quickest look method, just cheat. All is fair in love and life, right? Normal axis is minus 30 to 90. Left axis is anything more negative than minus 30. And right axis is anything more positive than 90. Right? And notice something important here. Initially, I didn't use any degrees because Axis is not really about numbers, it's about orientation. But where it matters is because it tells you when an ECG looks wrong for a reason. So take dextrocardia. If the heart is sitting on the right side of the chest, what you will find is lead 1 goes negative instead of lead 1 being positive, right? And go look at my Instagram page for the one on dextrocardia to get a better look. So you have lead 1 that should be positive looking negative. AVL suddenly then looks positive, right? And the chest leads don't show normal R wave progression. They actually get smaller as you move across. That ECG is not broken. It just means that the anatomy is different. Or sometimes maybe the leads are wrongly placed. So you want to see how the leads are placed. And if you don't recognize that, you can completely misread everything that follows. You think it's probably, of course, what you see when you start seeing poor R wave progression, you start thinking about ischemia, hypertrophy, or even think that the rhythm has a problem, right? And that is why axis matters, not just because exams ask about it. So one thing other people use is they say left axis deviation means left to kiss, right axis deviation means right to leave. So if your QRS is more negative in 1 and in AVF, right, it's more positive, right? So that means they want to kiss. So it is left to leave, left to leave and right to kiss. So this is right axis deviation, right? Because lead 1 is negative and AVF is positive. So that's a simple mnemonic. Like I said, all is fair in love and life. Left to leave, on the other hand, would mean that in your AVF, for instance, in your lead 1, for instance, left to leave, what you'll have is, let's see, permit me, right? And so this is very positive, and this will be negative. So this is not very accurate, but what I mean is that the QRS is very positive in lead 1 and it is negative in AVF. That is right to leave, and that is right axis deviation. So know the axis. If it ever felt abstract and confusing, I hope this makes it better. And if you need any clarification, let me know. Save this, because anytime an ECG feels uncomfortable, axis might just be the thing that steadies you.